As part of our family-centered care, all newborn cares will take place in the patient's room, including the 24-hour testings and the first bath. This supports bonding, parent involvement, and ensures safety. All my information is coming from the Neonatal Skincare 4th edition, evidence-based clinical practice guidelines from AWHONN. So the care that could be completed at mother's bedside would include doing the first baby bath, CCHD testing, PKUs, hearing screens, TCBs, and serums. In order to save on time, go ahead and gather the supplies that you need. Make sure you grab supplies for your PKU, the CCHD, bath supplies, TCB machine, and just in case, I would go ahead and grab a bilirubin tube just in case. We do have some tub baths that will be on a cart, so you can take that cart to the room and complete your baby bath on the cart if you wish to do it that way. According to AWHONN, there are 3 appropriate ways to bathe a newborn. Immersion tub bathing, it's like the swaddle bathing but without the swaddle, so baby is just sitting in the tub. Then you have the swaddle immersion bathing, where baby is in the tub but swaddled up in the tub. And then your traditional sponge bathing. Each method is safe and choice depends on the baby's stability and family's preference. Now here's just some evidence. AWHONN does tend to lean more towards swaddle immersion bathing because it minimizes stress and keeps them warm and supports bonding. This also decreases stimulation, which is good for our NAS babies. There has been raised concerns that immersion bathing might delay cord healing or increase infection risk, since we often teach parents to keep the cord dry. However, the evidence shows otherwise. Research demonstrates that immersion bathing does not delay cord healing, does not increase infection rates, and there are no differences in bacterial colonization of the cord compared to sponge bathing. Here is a quick video on the benefits of swaddle bathing and how to do them. This video does promote the turtle tub, but we have the first year's Sure Comfort tub, and it works just as well. One thing that I do is I put a trash bag over it to help with the cleanup process. Enjoy the video.
During swaddle bathing, one extremity at a time is exposed for bathing. The infant is kept warm and comfortable throughout the bath. An infant can be immersed with the umbilical cord still intact, and with gentle washing, the protective vernix remains on the skin. Infants can also be bathed without the swaddling, immersion tub bathing. However, swaddle bathing is more effective at maintaining body temperature and decreasing stress. Swaddle bathing helps avoid adverse clinical outcomes associated with traditional sponge bathing. When immersed, infants are significantly calmer and warmer compared to traditional bathing methods. Minimizing cold stress decreases risk of hypoglycemia and hypoxemia. Preterm infants are particularly susceptible to hypothermia and negative effects of stressful experiences due to immature brain formation and low body fat. Swaddle bathing may save time for nursing staff. Delayed bathing combined with the support of the turtle tub helps parents feel more at ease so they can participate in the first bath. Keeping a newborn calm and warm during bathing may also eliminate time under the warmer, so the newborn can move directly to feeding or skin to skin. Swaddle bathing supports developmental care by decreasing stressful sensory experiences and involving parents in caregiving. When parents bathe their infant in the hospital, they have improved confidence and skills to bathe their infant at home. Implementing a standardized bathing system with the turtle tub creates a marketing advantage for your hospital. Immersion bathing is an evidence-based best practice for bathing, and the AWHONN skincare guideline supports immersion tub bathing and swaddled immersion bathing. In addition, a content, happy baby during bathing is a strong parent pleaser and a positive emotional memory that may enhance patient satisfaction.
I recently performed a swaddle immersion bath with a newborn, and the experience was very positive. The baby remained calm, comfortable, and did not cry throughout the entire bath. The only time the baby did cry is when I took the baby outside of the swaddle to get him dressed. This shows us that swaddle immersion bathing is not only safe, but also soothing for infant, reinforcing that it's a practice we can confidently use with families. So the steps to a swaddle bath would be to gather your supplies and prepare the environment, like warming up the room by turning the heat up, and then fill the bath. Then you're going to want to swaddle the baby and then put them into the water. We're going to wash the face first. Remember, don't use soaps on the face. We're going to unswaddle one limb at a time and wash them. You're going to soap them up and then rinse that limb and place them back in the swaddle. The goal is to minimize the time outside of the swaddle. You want to unswaddle the torso and wash the tummy area, unswaddle the genital area and wash gently, and then you are going to turn the baby to the side to wash the backside. So I made a quick video to kind of show you what it could look like when you do a swaddle immersion bath. I hope you enjoy it. Now that you've seen that, I want you to just remember everyone may do their bath differently. What works for me may not work for you as far as comfort. The expectation is to complete all baby cares in the room, and the nursery is able to come out and help when they are not busy. Please don't let this intimidate you. You are all wonderful nurses and you can do this. Now you'll see some cute pictures of a baby getting a swaddle immersion bath. They're so cute. Okay, bye.